In this unit, we will talk about ovarian endometriosis that occurs in 2 to 10% of women of reproductive age. The ovary is commonly the exclusive location of endometriosis in adolescents. It may be associated with painful symptoms such as dysmenorrhea, ovulatory pain, chronic pelvic pain, and dyspareunia. When dealing with ovarian endometriosis, it is crucial to minimize the surgical damage to the healthy parenchyma surrounding the cyst, to spare the reproductive and hormonal function of the ovary, especially in adolescent patients. Therefore, we avoid coagulation and use of electrified instruments to perform the cystectomy, preferring the stripping technique, which consists in separating the cystic wall from the ovarian parenchyma by gentle traction and counter-traction, exploiting the cleavage plane between the two of them. This technique has been associated with a lower risk of ovarian reserve reduction and ovarian tissue damage. In the case linked below in this unit, we can observe a large right ovarian endometrioma. Ovarian involvement by endometriosis is often associated with adhesions between the ovary and the peritoneum of the homolateral ovarian fossa. We also observe peritoneal lesions on the peritoneum of the uterosacral ligaments. Before approaching the cyst, we proceed to remove adhesions to obtain a better mobilization of the ovary. Then, we cut the ovarian surface just above the cyst, observing the spillage of dense, chocolate-like fluid typical of endometriomas. The rupture of endometriomas is a very common occurrence since the cystic wall is often very thin and tightly connected to the surrounding ovarian parenchyma. We then proceed with the aspiration of the remaining fluid, reducing the cyst's dimension to ease its removal. As demonstrated by several studies, cystectomy is superior to drainage and coagulation by bipolar diathermy in terms of disease and symptoms recurrence. Afterward, we proceed to stitch the ovarian parenchyma with an absorbable thread, both to control the bleeding and to restore the normal anatomy of the ovary.